Heroin is an opioid made from morphine, a natural substance taken from the seed pod of the poppy plant. Heroin can be a white brownish powder or a black sticky substance known as black tar heroin. Heroin can be taken many ways, which includes injected, smoked, or snorted. White heroin is more refined and pure and usually arrives to the U.S. from South Asia. Most of the powdered heroin sold in the United States has fillers or contaminants added such as sugars, starches, and powdered milk. Heroin that comes from Colombia tends to be brown and chalky. Black tar heroin looks like a black Tootsie Roll when the drug is cold. It's a hard substance, but when it's warm it's sticky like roofing tar. Heroin has many nicknames which include smack, dope, brown sugar, China white, and H to name a few. Heroin binds to opioid receptors in many areas of the brain, which involves feeling of pain and pleasure. The receptors are also located in the brainstem, which controls processes such as blood pressure, arousal, and breathing. So users use heroin to achieve an euphoric feeling and as a painkiller. Products containing heroin were once sold over the counter. In the early 1900s, products containing heroin, such as cough drops and remedies for infant colic, but within a few years, heroin was found to be 2 to 3 times more potent than morphine and rapidly absorbed by the brain. New drug users are getting hooked on heroin because it is cheaper and easier to obtain than prescription pain relievers such as OxyContin and Vicodin. The immediate signs and symptoms of an individual is slowed breathing rate, slowed heart rate, and feeling drowsy. Severe itching is also a side effect of heroin use. Opiates can produce histamine, which is the compound of the body produces during allergic reactions to be released. That is why you often see heroin users with scabs on their arms. Long-term use of heroin can lead to heart problems, abscesses due to needle injections, liver and kidney disease, and collapsed veins. 50 to 70% of heroin users suffer from a non-fatal overdose. Heroin is one of the world's most highly addictive opiate drug. Whether it's injected, smoked, or snorted, heroin enters the brain quickly and can cause a range of physical and psychological effects. Signs and symptoms of a heroin overdose are pinpoint pupils, decreased respirations, cyanotic, which is a bluish color, drowsiness, seizures, slurred speech, decreased heart rate, and loss of consciousness. If you suspect a heroin overdose, check for signs of an opiate overdose, which include slow or no breathing, gurgling, gasping, snoring, clammy cool skin, blue lips, and blue nails. Try to wake them up, call 911, follow instructions from the 911 dispatcher. Stay with the person until help arrives. You will not be arrested or get in trouble if you yourself have been also using heroin. You are protected from getting arrested by Good Samaritan laws. Naloxone, better known as Narcan, is an opioid reversal drug. Narcan attaches to the same parts of the brain that receives opiates, and it also blocks the opioids for 30 to 90 minutes. Narcan only reverses the effects of opioids. It can be administered intravenously, intranasally, or intramuscular. You can now buy Narcan over the counter at your local pharmacy, where the pharmacist will teach you how to use it if you have a family member or friend that is susceptible to an opiate overdose. Although heroin can be classified as a natural substance due to its plant derivative, the lasting effects of usage can be deadly. Signs and symptoms of the use of heroin can range from the slowed breathing, slowed heart rate, and a feeling of drowsiness. Long-term effects ranging from heart problems, abscesses, liver and kidney disease, collapsed veins, and an increased risk of AIDS and hepatitis from dirty needle uses. Most importantly, know the signs and symptoms of drug usage and call 911 immediately. If you suspect an overdose, always remember to never leave the person alone until help arrives.